take this away.
Hi, so we're going to talk about how to navigate puberty. When I was thinking about this, you have kind of your physical change and your kind of start of puberty, which is the beginning of adolescence. And then you have some of the challenges or new things that happen when you're in adolescence. So I am, for the sake of time and just because it's such a huge topic, kind of sticking more to kind of starting puberty, what happens to your body. With some thoughts at the end of things to really start to think about as a child kind of progresses into adolescence. Next slide. So this is just kind of our objectives for the day. Next slide. So really, puberty is really a stage of development when genital organs mature, secondary sex characteristics start to emerge. So things like breast development, facial hair, underarm hair, voice changes, etc. And then adolescence begins. And really, adolescence is that really crazy time that's between childhood and adulthood. And then on top of that, puberty is kind of embedded in adolescence. So lots of changes, lots of new expectations, lots of scary real world things coming kind of all at one time. Next slide. So some things that you're going to see with anyone going through puberty is you're going to have those physical changes. So lots of hormonal changes, surges in hormones. You're going to have a lot of body changes, lots of different body development. And you're going to have a lot of sensory changes, which might really include a lot of increased sensitivity to stimuli from both like external sources and then inside your own body as well. You're also going to see social and emotional changes. So you're going to have all these new emotions and feelings. There's going to be a lot of changes in social dynamics and social nuances. Think about kind of what high school was like. There you go. And then you're going to start developing an interest in relationships and sex. And then you're just going to start feeling kind of different responses to other people and familiar people. So I know in the case study was talking about, is it appropriate to maybe shower with someone who's 14 years old? Maybe at some point he would be okay with that, to have mom come in the shower to kind of help him, learn what to do. And now all of a sudden he's just like, that makes me feel really uncomfortable. So those are some new kind of feelings that individuals may have. Next slide. Other challenges during puberty is just communication and social interactions in general. There's a lot of social cues related to friends, social norms, etc. I think in this day and age, there's a lot of things that are relating to social media, which can be really confusing for anyone, including adults. And then you just have this whole new social interactions with like romantic interests. So how to approach romantic interests, same-sex individuals, whatever that is kind of how to navigate that. Next slide. Self-regulation is also really challenging during this time because you have all these emotional changes that are just normal, and then they're also exacerbated by hormones in general. If you're a female and you're getting your period, and they can be exacerbated by that. You do have a lot of increased sensitivity to sensory stimuli, so that might just be harder to deal with internal sensory stimuli, changes in your body shape. You have hair on your body and face. There's new odors. There's blood maybe. So these are all things that can be really challenging. Next slide. Some other challenges during puberty is that really medications can act differently as an individual enters puberty. So I want to stress it's really important to talk to your doctor about any medications that your child is on, especially for medications related to maybe things like reflux, but also for anxiety or any medication to help with like ADHD or any kind of psychiatric condition. You really want to talk to your doctor about that. Um, what changes might you want to look for? Are there things that they can do to help? So maybe the dose needs to be adjusted. Maybe there's a different medication that seems to work better in individuals once they've kind of started puberty or gone through puberty. This is something that you really want to have an active discussion about. And additionally, some individuals might benefit from medications as they enter puberty due to changes in behavior, mood, or attention. So maybe your child didn't need some medication or support for attention. But as puberty is hitting and hormones are coming in, and there's changes in your body, and there's also changes in what's expected from you in the community and school and socially, that maybe some medications would be helpful at that time. Next slide. And so some additional challenges within puberty and autism is, I want you to remember that people with autism may experience delayed social and emotional development, which can impact that transition of adolescence and early adulthood. But most likely, they're going to undergo puberty's physical changes within a typical time frame. So basically, a person's going to have this physically mature body, but without the maturity in the other areas. So that is something to think about. Next slide. Uh, Autistic individuals can have sensory sensitivities, they can have sensory seeking behaviors, or they might have like really strict sensory preferences. They can have a lot of difficulty with interoception, so how you sense the internal functions of your body. Is your stomach telling you it's hungry? Is your head telling you that it hurts and you need something to drink? And all of that difficulty with interoception really impacts how you kind of understand your emotions as well. And then people with autism also have social communication difficulties. They have a lot of extra difficulty understanding social cues and norms. Next slide. People with autism can have difficulties with understanding and receptive language. So maybe telling them to do something isn't enough. They can have difficulties communicating with others, so kind of letting others know what it is that they need or what they need help with. And there is also an increased comorbidity with some coexisting conditions such as ADHD, learning disabilities, or anxiety. Next slide. So one of the things is timing. Autistic individuals and people that do not have a diagnosis of autism usually start puberty around the same time. There is a little bit of research that shows that females might start puberty a little bit earlier if they have an autism diagnosis, but generally puberty kind of can start between the ages of 8 and 13 in females and 9 to 14 in males. Remember, puberty looks different for everyone. Just think about your own experience and the people around you and your friends and kind of how some people went through puberty a lot earlier than others. Some had acne, some did not. So there is really quite a range, which can be difficult for children, especially with children with autism, like wanting to know exactly what to expect. You really can't always give them a really clear answer about that. Which is also anxiety producing for everyone. And then just being prepared, being proactive is key. So I like to say for females, you want to start around ages 6 to 8, males 7 to 9. You really want to start preparing them for the changes that are to come. Just help them understand their bodies too. Next slide. So some things to help prepare, start early. Always use proper terms to describe body parts. You want to use words like penis, testicles, vagina, etc. It's going to help prevent confusion, especially if your child has difficulty with expressive communication. We don't want them trying to use a nickname of a body part to try to tell somebody that someone touched them there or something hurts in that area. That might cause a lot of confusion, and then that need might not get addressed. Answer any questions that your children come up with about differences between males and females, as well as transgender people. Children are curious, it's natural. I always say be open about how babies are made, especially if a child asks. Another thing that I always say is give a child as much information as they ask for. Don't, especially really young kids, you don't need to give more. There's no need to expand early on. There's lots of books for very young children. And then there's also books for, older children that discuss differences between boys and girls, also about, childbirth and how people get pregnant. This is just a book example of one that I like. Next slide, please. Start early teaching privacy. Help your child learn what it is and how to find it. Model appropriate hygiene so that your child early on watch you in your hygiene routines. Again, I'm just stressing use correct language for body parts and functions. And then start practicing all these things, even hygiene routines earlier. The sooner a child develops a routine, the sooner they will get used to it. It'll be easier to integrate skills into life. So letting your child, for example, have some independence or some practice, like bathing themselves very, very early, 3, 4, or 5 is, making that part of a daily routine is going to help when your child is 12, 13, 14, and maybe wants to do it by themselves. And maybe the expectation is now that they need to shower every day. So we want to kind of get that routine in place. Next slide. Some things to think about. It's okay to allow your child to shower with you. The general rule is that should kind of stop when your child is starting to show signs of discomfort. Maybe he or she wants to be more independent or starts expressing a desire for privacy. This usually starts like before prepubescence. It can maybe start between the ages of 5 and 8. It also, of course, can be dictated by your child's need for supervision and help with things like bathing tasks. The same goes for toileting needs. Again, this can be dictated by your child's need for supervision and help with toileting tasks, or maybe your child is dependent on diapers. Next slide. One thing we always need to talk about is to teach your child about good touches and bad touches, private and public behaviors and places. I'm going to use age-appropriate and consistent language and really encourage open communication. Remember, children may exhibit behaviors when they have questions, so like touching themselves or touching others. If they have difficulty communicating that and being able to ask questions, some kids have a hard time asking for help. So they also have a hard time for asking for questions or for information. That might be kind of their, like you being a detective and you're like, oh, they're curious about what's in their underwear, or why that person body might look different than their own. So it might be a way that if you see these behaviors to bring kind of those conversations up. And then you want to teach some body boundaries and the right to say no. Next slide. Teach children what to do. I always say if you want to be able to teach an effective skill to everyone. So if your child, if something feels unsafe to a child, you want them to tell a safe adult. So you want to empower your child to tell someone. Things like, they were great recommendations in a case study, like using books, videos, social stories. It might be helpful to have pictures of safe adults, maybe like a chart of body parts with the correct words available for a child to reference. This is really helpful too if your child's expressive language is limited. A picture book of like safe people your child can go to might be helpful for sure. And then making sure that all of your local police, people in your community know your child and that he or she has autism. Next slide. So these are just some pictures. This is a nice little handout about like understanding touch and kind of like what areas on your body would be considered private. When is it okay for an adult to touch my private parts? My 3-year-old nephew is always telling me about, he had some pain in his testicles, and he has a list of people that he'll just recite of that who's allowed to touch his testicles, Dr. Andy and, mommy and Aunt Christy. And so, starting really, really early so that they know that can be really helpful later on. Next slide. Also, to help prepare, I say teach your child at a young age about appropriate clothing choices, especially for like the weather. Maybe things like sitting with your legs closed or crossed and not lifting up his or her shirt when you're out in public. Again, that might be more of a private behavior. And then always, always, always take into consideration individual sensory preferences for clothing. And considering that some of the behaviors, maybe a child fidgeting with their clothes or lifting their shirt up is a way of them communicating to you that they're having, like, they don't like the sensory feel of this particular shirt. So always kind of put on your detective hat. Next slide. These are just some nice ways to kind of help talk about body changes, and then how you might word it for somebody who learns better with words and understands language. And then a child who learns better by pictures or has challenges understanding verbal languages. You're really going to simplify that. You're going to use a lot more pictures. I have an example on this on one of the next slides. So next slide, please. So this is a nice kind of like step-by-step. I couldn't fit it all on one page, but just social story, like I'm growing up, used to be small. This is what happened, showing that areas on their body that hair might be growing, what kind of things you're going to need to do. And sometimes you might feel really good about that, and sometimes it might be embarrassing, and that's okay. So next slide. And here's another one for girls, kind of talking about things like yep. And then I know it's really hard to talk about these things with your child. Might feel easier to use things like analogies, but it's really best to provide clear information. And children with autism really can struggle with understanding things like analogies. Be sure to just create a safe and supportive environment. This is going to help ensure an open dialogue and trust from your child. be ready to discuss possible scenarios. And then in all the resources that will be sent out, there'll be a lot more additional resources that you can definitely reference. Next slide. All right, so these are some hot topics that come up a lot in puberty. So self-care is a huge one. Next slide. So a lot of challenges with self-care can be with understanding or participating in these tasks. So that can be the initiation, starting a task, sequencing the task, flexibility and rigidity can get in the way. So if you really want things a certain way, when you take a shower and then that day the shower head is broken and you need to take a bath instead, that can really throw off the whole routine. Motor planning and coordination can be a problem. And then just like timely execution. So being able to stay on task to finish a self-care activity in a reasonable amount of time to be able to get to school or get outside to play or anything else. There may also be some sensory issues related to any kind of self-care task. So I'll just get like pads or tampons could be irritating. Washing your face could be hard if you don't like the way water feels on your face. Razor burn or facial hair can be also really stressful. And then a child with autism may have decreased sensory awareness of their body processes. So not even aware that they're sweating or they have not changed their pad or tampon for a while. They may not recognize the smell. So that can be a challenge with self-care. Next slide. Your child may also have difficulty with the physical aspects of a task or the motor planning of a new task. So adaptations and modifications to tasks or items can be helpful. Working with like maybe an occupational therapist to work on increasing like your fine motor skills and your hand-eye coordination, being able to grade pressure and force to be able to do things. Like for example, to hook a bra, you need a certain amount of force, but not too much or else it won't work. So some like adaptations that you could try would be trying various styles based on sensory needs and preferences, like using a front opening bra instead. You can do a bra without hooks. You can change the hook for like a Velcro fastener on a bra, those kind of things. Next slide. It's really helpful to work with an occupational therapist, and also if you have one, an applied behavior analysis provider. Sometimes autistic individuals may not be aware of social implications of poor hygiene. So you want to talk to your child while this is appropriate. If that buy-in is really hard, you want to make daily bathing kind of like a rule in your house, using things like timers, reminders, visual schedules, rewards, incentives. As individuals become adolescents, it might be harder for you to monitor how thorough they are with their bathing and all those things. So it's really important to start early and work to teach those skills early on. It also sometimes can be more helpful to have an outside person, not someone in your family, so like an occupational therapist or an ABA provider, to work on those skills with your child as they get a little older. Next slide. These are some social stories about deodorant, for example. The one on the left is for maybe somebody that does better with reading. The one on the right, it's somebody that might learn better with pictures. Next slide. This is kind of like a step-by-step like shaving like sequence of how you're supposed to do that. Next slide. And here's one for the bath. Next slide. I always say for like, you can laminate these and put them in your bathroom. You can use like clear contact paper or even plastic wrap just to keep them from getting like wet and ruined if you print them out or draw them. Some things like just some shaving tips, for example, trying things like electric razors, standard razors. You can do waxing. This is for both men or women, at home or at a salon. You can go get a professional shave at a barbershop. You can use creams like Nair to, eliminate hair. You can, if your, son wants to grow a beard, you can work on growing a beard and having it styled and how to keep it neat. They do make some silent razors and shavers. So that might be, a lot of individuals that tell me like they just don't really like the way that the sound of the shaver is terrifying. So something to think about. There's all different kinds of different like shaving creams and gels. So some people really like gels, some really like creams, some don't like any of that at all. Gradual introduction and desensitization might be helpful. That is like across the board for every new activity, especially anyone that's like a little sensory sensitive. Visual schedules are also really helpful. And then always making sure that your child has the adequate fine motor skills and coordination to manage shaving tasks. Next slide. Deodorant, there's also like various deodorants that can meet your child's sensory preferences. There's gels, there's creams, there's sticks, there's sprays, there's like the crystal rocks. You can discuss underarm Botox injections with your doctor, so that helps with sweating, but there is some research that it also helps with odor. Be mindful of scents. So sometimes it's not the way that the deodorant or some of the other bath products might feel, but it's just this scent is something that they don't like. It's overwhelming. So, have your child go to the store and smell all the deodorants and find one that they like. You can do a scent test each morning. You can do timers and other visual reminders can be helpful about when to use deodorant and when to reapply, like especially things like before and after gym class. That is a way to get OT sometimes in school, is that if you can relate some of these self-help skills to things that they need to do within the school day. So if your child has to change from like their school clothes to gym clothes, and kind of clean themselves up after gym class and they're having trouble with that, that might be a way to get OT in school to work on self-help needs. Same thing with toileting. If they're having trouble like managing their menstrual needs, or they're having trouble like managing their pants, or like thoroughly wiping when they use the bathroom at school, that can be another thing that you can talk about. I just want to mention that. Next slide. For bath and overall hygiene, you can try various soaps and products. Loofah mitts are nice because it kind of goes like a glove on your hand. So a child that doesn't have a lot of dexterity can really use that. You can experiment on different washcloth textures, body scrubs, cream soap, oil soaps, bar soaps. Again, think about scents, shower pressure versus, think about the difference between a bath versus a shower. You can consider, some families will take their child and get their hair washed professionally, or they'll wash their child's hair in the sink like once a week. That helps if they have a fear, especially of like water on their face. I always find if you can teach a kid to do these things, him or herself, that the acceptance, like the sensory acceptance, is always a lot better, because you can teach them how they can control it themselves. And that just really helps like squash a lot of the anxiety they might have of, instead of like somebody doing it to them. Visual schedules, again, making sure their fine motor skills and coordination can manage the tasks. Adapt tasks is needed, and really an OT can really, really help with this. You can do like fun things at home, like face mask nights or spa nights for skincare. Some kids really like going to get like a teen facial somewhere. For pimples, you might want to consider like pimple patches, like the little stickers. You can speak with a dermatologist or your doctor about like any oral medications or other acne products. In general, the simpler usually the better. You'll get the most buy-in from your child that way as well. Next slide. So another hot topic is menstruation. So really communicate. You want to show and tell your daughter about this. Try social stories, videos, books, pamphlets. Other people can kind of share their experiences. Maybe there's some classes in school that will teach some of this. Things to talk about would be body changes, how to use things like a pad or a cup, tampon, period underwear, how to dispose of these. Include your daughter in, visits to the store and purchasing items. Stress and support the importance of routine. Consider, again, like auditory or visual reminders to change your pad, like an alarm that goes off on your phone, or a watch that has an alarm. So, every 3 hours you need to change your pad, whether or not there is blood on it. Maybe some different options for hygiene when you're on your period. So using baby wipes, bathing more frequently, and then also thinking about like any kind of cultural considerations within that. Talk to the girl in your life about pain during or before their period, and maybe how to manage this. There's just a picture of like a FACES scale, which we'll use here in the hospital. So if a child can't really like verbalize how they're feeling or how much pain they're in, they can point to the picture that kind of helps tell us like how much pain that they have. And then discuss medically available options with your doctor. So birth control to prevent pregnancy, alleviate menstrual symptoms. Some birth control can be used to kind of like stop periods altogether. So you really want to have that conversation with your doctors, making sure that you're taking your daughter to like an OBGYN early on. Next slide. This is just like a period social story example for a child that has good verbal language and can read. Next slide. This is like a visual social story about when you get your period and how to manage a pad, for example. Next slide. You can use period tracker app or calendar to track period and flow. This will help everyone prepare. So you'll know, school know, your daughter will know. Be sure to let school know and have it built into the IEP or 504 plan so that, she can leave the class to use the bathroom. She can access the nurse or products as needed. So she doesn't have to like raise her hand and say, hey, I need to go to the bathroom because I have my period, that she's allowed to just get up and leave. Always be prepared with extra products and change of underwear and clothing. Try different menstrual products based on like lifestyle and sensory preferences. You can try using things like ibuprofen or other medications like Aleve to help with period symptoms or pain. Be proactive. Sometimes those medications can also help decrease the amount of menstrual flow, making sure fine motor skills can coordinate and manage all the products. And then also like other pain relieving. So yoga, meditation, hot packs, things like that can also help. Next slide. Another hot topic that comes up a lot during puberty is masturbation. It's really typical for children to explore their sexuality, no matter what their ability is. Expect this. It might not have, like, even young children, it might not have any sexualized context, but it's more of a sensory seeking behavior. It might be something to help a child self-calm or regulate. There is always a risk for injury due to sensory differences and challenges with motor skills. So things like rubbing too hard or experiencing chafing. So there does need to be an aspect of like teaching and coaching around this as well. Social norms may not be understood. So, really wanting to work on teaching to do this type of behavior in private, not public. Peer-driven responses are absent. So if an individual who's motivated by like social acceptance or the approval of others, this is something that they're not going to get that approval for, or they're not going to get that feedback unless they're doing it at school and somebody says like, why are you doing that at school? And I know it can be difficult for parents and just the public in general to accept, but it's really a normal part of growing up. Next slide. So these are like little social stories of like when you can masturbate, where. Next slide. Some tips for males: consider low extremity clothing and underwear, relax fit boxers and certain materials like basketball shorts, for example, might bring out an unexpected erection. So consider more form-fitting underwear, tight boxer briefs, or wearing like lycra shorts under clothing. For females, you can consider harder to remove clothing, like more like a leotard, or wearing lycra shorts under skirts. Having fidget items or preferred sensory textures available if your child engages in self-stim behaviors or out of boredom. So that's a reason sometimes individuals masturbate. They might just need more sensory input throughout their day. So, find yourself an OT and speak with an OT about how to get more sensory input throughout your child's day. And then consider the benefit of items like vibrators or other aids. They might be useful for a child that might have a physical disability or is having trouble with like grading force or pressure. Next slide. Safety. It's a big one I just want to talk about because there's a lot of like emotional changes in puberty. So there's a higher risk of things like elopement. It might be like you're confused, you're overwhelmed, you're frustrated, think about other possible triggers or what might be helpful. People with autism are at a higher risk for abuse, so teach rules about strangers, secrets, and touch. Autistic individuals might are at an increased risk of being taken advantage of just due to difficulty understanding some of the social cues or wanting to please others or being unable to speak or tell others. So some things to think about is like, why is maybe a reason that your child might be more of risk. And then aggression, it could be towards their self, it could be towards others, it could be sexual aggression or otherwise. It just might be due to like feelings that are hard to control, sensory needs, confusion, difficulty communicating. So you might see these kind of behaviors because of that. Next slide. Some things about internet safety. I think it's important to talk to your child about this in this day and age. So some things you might see, really make sure your child knows how to use the internet independently, establish rules and like etiquette around it. Make sure that your child knows what to do if any of the issues above occur when they're online, like bullying, scams, pornography, those kind of things. Um, Things like don't give out personal or private information. Make sure your child knows how to safely purchase items online. Do not continue interactions with people who might make you feel bad, call you names or mean. Do not send money to anyone. Think catfishing. Consider online trackers and blockers. Consider removing any kind of webcam access. Make sure you're checking your child's gaming systems because a lot of those have ways for players to watch each other video chat and direct message each other. Consider having the computer in a more public area of your home. Discuss use of social media and making sure your child understands like do not share naked or private pictures by phone or computer. Next slide. And these are just some other things to think about. Self-esteem. So, individuals when they're in adolescence really start to explore and understand their own sexual orientation and general identity. It's really crucial to create an open, supportive, comfortable, and safe environment. Next slide. Thinking about relationships and datings, that's something that's going to come up. And just, kind of reminding that friendships and healthy relationships are really built on consent and mutual respect. Next slide. And then sex also comes up a lot in adolescence. So seeking guidance from your child's doctor, take your daughter to a gynecologist, consider the HPV or other vaccinations as recommended by your doctor, and conversations about safe sex must occur. And you want to also talk about things surrounding consent and birth control. Next slide. And then some other areas would be for that transition to adulthood, additional schooling, career and vocation exploration, living situation, what's going to kind of that look like as they get older, what kind of support may your child need, and then working on your child with money management and savings. And then, always kind of think of like, what if something happens to you? So those are the things that you want to think about as you plan in adolescence. Next slide. These are just a nice little slide of kind of a lot of things that occupational therapy can really help with during puberty. So I'm going to do a big push, find an OT. Next slide. And just remember, it's a time of significant change, and this can really lead to a lot of increased anxiety, increased meltdowns, lots of feelings of being confused and becoming overwhelmed. It's normal. We all went through it. Next slide. So in conclusion, just start early, be open to frank and possibly uncomfortable conversations. It's all normal. Refer to all the resources that'll be sent out today. Autism Speaks Puberty and the Adolescent Toolkit are great examples. Use your child's team, everyone on your team, doctors, therapists, teachers, include your child. And remember, you're the expert in your child. And just provide guidance, love, and support around, their physical changes, self-care, emotional well-being, and safety. Okay, I think that's it. Any questions or anything people would like to share? Any tips?